Regardless of whether or not your Medicare Part D plan has changed, seniors must still shop for plans every year. Here to speak with me today about that is Marcia Mantell. Marcia, thanks for joining me.
I'm great to meet you, Zach, and I'm so glad to be here.
Thank you. So, in your article, you describe this requirement that seniors kind of have to shop for a Part D plan every year as ridiculous. If it's
Yeah.
such a pain for people who are 65 and older, why do they have to do it in the first place?
Well, that's a great question. That's the same one they're asking me. Like, what did I get into? I never had to shop for plans every year for drug plans when I was working. Well, Medicare is just different. The Medicare law is set up in various parts, and Part D is the part that helps seniors pay for their cost of drugs. And it has lots of pieces underneath it. But basically, what's happening is there are powerful players. There's the manufacturers, there are the insurers, there's who's offering which drug coverage in your zip code. So all of that gets reassessed every year. So even though you haven't done anything differently, all the players in this game have done lots of things differently. So they make it an opportunity, as they would position it, that you can reshop your plans and get something new if it's cheaper. Same drugs, cheaper price. But when you're 80, 85, 90, 95, my in-laws are 100, this is not something you do. So I find it just completely ridiculous that we are making our oldest citizens reshop. And if you don't, frankly, well, I'll just say it, you get screwed because the pharmacies come in and out of favor. Prices go up, they rarely go down. And if you don't change every year with the changing of the tide, you've missed out. You pay more.
And you talk a little bit about the different zip codes in terms of these power players. How come there are different plans that offer different costs per month based on where you are in the United States?
Yeah, there's some underlying insurance practices and rules that you get to price things as insurers. The insurers are helping all of us mitigate risk and spread our risk around. But you do that based on not only the population of a certain area, so that you know that population and what their risks are towards either getting particular illnesses or how long they're going to live and the drugs they take and such. But it's also, there's pricing by region. It's the same as when you get a job offer, a marketing manager, let's say, in New York City is going to pay a whole lot more than Des Moines, Iowa. So we have these regional differences as well. And all of that gets brought into pricing models and still staying within the rules, but it comes down to zip code. That I live south of Boston. It's a little bit cheaper to live here than living in Boston proper, but not that much. So our prices don't swing too much. But it's very different here than living in one of the zip codes I track is where I lived as a kid in Kentucky. It's very different in rural Kentucky than it is in, East Coast coastline.
Yeah, and in your article, you compare the prices from 2023 to 2024 on a year-by-year basis, and you note anywhere between a 94% and 100% drop in pricing. How come these prices have dropped so significantly in just 1 year?
Yeah, it was was this on the, haven't read the article for a while. Was this on the premiums or the overall drug pricing? Let me look. The premium price drop with this Wellcare, what was the 50, there's only one provider that offered a 50-cent premium. And so these prices dropped dramatically and they wouldn't give me a reason why. I did call and I emailed and I went on Twitter and so forth. And I got a runaround, but I think the reason they're changing these prices so dramatically is because we have another overarching law that has come into play. And it's the Infrastructure Reduction Act that President Biden signed into law. And it is affecting Part D plans quite significantly because there's a cap going on how much seniors are going to have to pay for both the premium and the price of their drugs. And it will be capped at $2,000 starting next year, 2025. So there's a lot of underlying pieces moving, a lot of moving parts. And for this insurer to decide they're going to offer, bargain basement pricing here for the seniors. Just says to me they're trying to drive in a ton of new people that will help their business model over the next 4 or 5 years.
Hmm. And so now, let's say deadline day is approaching, and it's time for seniors to either re-up their plan or enroll in a new one. Where do they go specifically to look for these plans and decide which one is right for them?
Yeah, they go to this fabulous tool on Medicare.gov. It was called the Plan Finder, but now it's just on the home page. There's a little box that says find plans. And you click on that box and you go right into the tool. And there you can look for Part D plans, Medigap plans, and Part C plans. So it is a one-stop shop. You load in your drugs and the dosage and how you take it. Is it a pill, a capsule, an injection? And you push a button. And all of your options show up sorted in order, least expensive combination of premium and drug pricing. So it's a fabulous tool. It is easy to use.
I agree. It seems very intuitive. So thank you, Marcia. Is there anything that we didn't talk about or that we should have noted or anything worth repeating?
I think the only key thing to take away, if you only take away one thing, just mark your calendar for every November 1st. If you are in Medicare, you have a Part D plan, check back November 1st every year. This is during its open enrollment season. So you can know, am I getting the cheapest price for the same drugs I'm taking, or did I miss something and I have another opportunity?
All right, Marcia. Well, thank you very much.
All right, Zach, thanks for inviting me on.